Here, welcome to your Dinesh channel. So, welcome to the part 7 of the 2018 Kerala Assistant Professor in Nursing exam question paper discussions. So, let's go to the first question for today. Emotions which is commonly seen in a passive aggressive personality disorder is. And the options are depression, guilt, anger, fear. And the correct answer is anger. Passive aggressive personality disorder causes people to express negative feelings and emotions such as irritability, anger, and pessimism subtly or passively rather than directly. Let's go to the next question. Oscillation is characteristically seen in, and the options are dementia, dissociation, depression, delirium. And the correct answer is delirium. The action of grasping at imaginary objects or plucking at one's bed linen is characteristic of people affected by delirium. Let's go to the next question. Which of the following drug is used to treat enuresis? And the options are imipramine, methylphenidate, olanzapine, risperidone. And the correct answer is imipramine. So how does imipramine work on enuresis? So it is a tricyclic antidepressant used to treat nocturnal enuresis or bedwetting at night. So it helps the bladder muscle to relax while causing smooth muscles at the bladder neck to contract, therefore increasing the ability to hold the urine in the bladder. Let's go to the next question. Narcotic Drugs and Psychotropic Substance Act was passed in the year of. Options are 1978, 1985, 1980, 1989. And the correct answer is 1985. Let us go to the next question. Capgras syndrome is most commonly seen in, and the options are catatonic schizophrenia, hebephrenic schizophrenia, simple schizophrenia, paranoid schizophrenia. And the correct answer is hebephrenic schizophrenia. So, disorganized or hebephrenic schizophrenia describes a person with the schizophrenia who has symptoms including disorganized thinking, unusual speech patterns, flat affect, emotions that does not fit the situation. So the Capgras syndrome or delusion of doubles or imposter syndrome is a delusional misidentification syndrome, and it is a syndrome characterized by the false belief that an identical duplicate has replaced someone significant to the patient. So what is an example of Capgras syndrome? For example, people with this syndrome may accuse the spouse of being an imposter of their actual spouse. So let us see what is Rigoli delusion. So the syndrome may be related to a brain lesion and is often paranoid in nature, with the delusional person believing themselves persecuted by the person they believe is in disguise. So it's a rare disorder in which a person holds a delusional belief that people are in fact a single person who changes appearance or is in disguise. So what is Folly ADX? It's an identical or similar mental disorder affecting two or more individuals, usually the members of a close family. So let us see what is Clermont syndrome. So it's a psychological condition named after Gatien de Clermont, in which the sufferer is under delusion that a certain person is in love with him or her. So there's another syndrome called Cotard syndrome. It's also known as Cotard's delusion or walking corpse syndrome. So it is a rare mental disorder in which the affected person holds the delusional belief that they are dead, do not exist, are putrefying, or have lost their blood or internal organs. So there is another condition called prosopagnosia. It is most commonly known as face blindness. So it is a cognitive disorder of the face perception in which the ability to recognize familiar faces, including one's own face, is impaired. So the self-recognition is also impaired in this syndrome. Let's go to the next question. Fear of cat is called. The options are allurophobia, apiphobia, arachnophobia, astrophobia. And the correct answer is allurophobia. So let us see the other options. Apiphobia is the fear of bees, arachnophobia is the fear of spider, and astrophobia is the fear of thunder and lightning. Let's go to the next question. Tuberous sclerosis is found with greater frequency in, and the options are mental retardation, autism, tic disorder, and attention deficit hyperactivity disorder. And the correct answer is autism. So, tuberous sclerosis is a complex genetic disorder and it is characterized by the growth of numerous non cancerous benign tumors in many parts of the body. So the tuberous sclerosis is complex, often affects the brain, and these disorders include hyperactivity, aggression, psychiatric conditions, intellectual disability, and problems with communication and social interaction. So these are most commonly called as autism spectrum disorders. Let's go to the next question. 35-year-old Primi Gravida came to an antenatal clinic with at 16 weeks of gestation. She was instructed to perform triple test. This test is used for the evaluation of, and the options are hydrops fetalis, Down syndrome, congenital hypothyroidism, phenylketonuria. The correct answer is Down syndrome. So the triple test is used to identify pregnant woman whose fetus is likely to be affected by trisomy 21, most commonly known as the Down syndrome. So what is double test versus triple test? In double testing, the markers measured are alpha fetoprotein and either total human chorionic gonadotropin or its free beta subunit, namely the free beta HCG. In triple testing, there is one more marker tested, that is unconjugated estriol. And in quadruple testing, there is one more test done for inhibin A. Let's go to the next question. Which of the following is the drug of choice for management of endometriosis? And the options are estrogen, human menopausal gonadotropin, danazol, duodenal. And the correct answer is danazol. So it comes in a class of medications called androgenic hormones, and it works to treat the endometriosis by shrinking the displaced tissue of the uterus. So the next question is benign ingrowing of the endometrium into myometrium is known as, and the options are adenomycosis, endometritis, endometriosis, leukomyoma. And the correct answer is adenomycosis. So endometritis is the inflammation of the uterine lining. Endometriosis is a disease characterized by the presence of tissues resembling endometrium outside the uterus. So endometrium is the lining of the uterus. And let's see leukomyomas. It's also known as fibroids, are a group of benign smooth muscle tumors commonly present in premenopausal women. Let's go to the next question. Active management of third stage of labor includes all the following except, and the options are early cord clamping, applying suprapubic pressure, prophylactic oxytocins after delivery of anterior shoulder, controlled cord traction. So the correct answer is applying suprapubic pressure. So let us see the next question. Which of the following is not a sign of placental separation? And the options are uterus becomes hard and globular, the extravulvar portion of umbilical cord shortens, the uterus rises in the abdomen, there is a gush of blood from the vagina. So the correct answer is extravulval portion of the umbilical cord shortens. So the most reliable sign of placental separation is the lengthening of the umbilical cord as the placenta separates and is pushed into the lower uterine segment by the progressive uterine contraction. So the uterus takes on more globular shape and becomes firmer. The uterus rises in the abdomen and a gush of blood occurs. So these are the questions for today. So if you like the videos, please like the channel and subscribe the channel. We'll come with the last set of questions, a discussion of the 2000 Kerala Assistant Professor exam in the next episode. Thank you.